19, the Paratransit Coordinating Council has chosen Zoom as its meeting platform. During the meeting, please mute your mic. So we're not going to mute the mic, right? We're going to all stay on. Next we'll have roll call, and I will call the name, and Fifi will notate who is present. So Janet Abelson, I'm here. Is Charlie Anderson here? Charlie's absent. Mary Bruns, absent. Is either Jean Clark or Maria Garcia here? Okay, absent.
I'm sorry, I just unmuted Maria.
Oh, okay, so Maria Garcia is here?
Yes, I'm here.
Welcome. Bridget Cooney?
I'm here.
Hi, Bridget. Michael, I know Michael's here. Michael, are you here?
I am here.
You are here, great. Okay, is Lisa Hammond here? Or Debbie Toth? Okay, absent. Vi Ibarra?
I'm here, good afternoon.
Hi. Rashida, we know you're here. Welcome.
Thank you.
Mallory Nestor? Is Kim here? Okay, absent.
No, Kim's here.
Deanna? Oh, Kim's here?
Kim's here. Let me unmute her.
You gotta give me a
Okay.
few seconds to unmute people, Janet.
What?
You're too quick. You gotta give me a few seconds to unmute people.
Oh, I'm sorry. I didn't realize you were doing it along the way. Okay. So Kim, you here?
I am here.
Welcome. Next we have Deanna Perry or Irma Sablaski. Either one of those people here?
I'm here.
Here?
Deanna Perry.
And which person are you?
Deanna.
Deanna? Okay, welcome.
Thank you.
The next person is Lori Reese Brown.
And Lori's here.
Lori's here. Welcome.
Yes. Thank you.
Othello Smith.
Here.
Welcome. And Laura Timothy. Laura Timothy here? I guess not, so she's absent. So do we have a quorum?
Yes, we do.
Okay, great. And I have to read the next section of the agenda verbatim, and so I'll do so at this time. I will request any committee questions and comments on an agenda item. If you would like to speak, please raise your hand using the raise hand feature of Zoom. Fifi or I will call upon you. Okay, let me stop a second. Does everybody know how to use is there anybody who doesn't know how to use the raise hand feature of Zoom?
Michael Dowgelli here. I'm on a phone.
Okay, so you're going to keep Michael and I unmuted, right? Fifi?
Correct.
Yes.
Okay, and so everyone else will be using the raise hand feature of Zoom.
Well, I'm on the phone as well. This is Lori. I'm on the
Yeah.
phone as well. I couldn't get through Zoom for some reason.
Okay.
I'm also on a phone.
I'm sorry, who is the last person speaking?
This is Bridget Cooney. I am also on a phone.
But we
Oh,
see.
okay.
But,
So you just arrived.
But we
Yeah,
see
you were.
you.
Chair Abelson
Okay.
and committee members, you can hit *9 on the phone to raise your hand in Zoom.
Oh, thank you.
Mhm.
So does anybody have a question about that? Just hit
This is
star
Vice
9.
Chair Dowgelli. Am I still going to be unmuted, or do I have to do *9?
I think you just do star 9. When in doubt, do star 9.
Okay.
Well, no, actually, it goes both directions, right? So you don't want to do it at the wrong time. So, okay. Is everybody clear about the raising hand item?
Well, except Janet, you said originally that I was going to be unmuted with you.
Well, that was because you were we thought you and I were the two people on phones. but there's more
Okay.
people on phones now, so we can't
Okay.
do it the same way.
Sounds
So-
good. I'll use *9 then.
Okay. And if it doesn't seem to be working, then I would suggest you try hitting it again, because then it'll revert the other way. And then hopefully it'll work. We'll see how it goes. Okay. Staff has the ability to unmute your mic. And after you speak, staff will remute your mic and lower your hand. I will request any public comments. If anyone from the public attending this meeting wishes to speak during an agenda item, please raise your hand or press *9 if you are on the phone. Can we ask if there is anybody from the public right now?
I have not received any public comment, Chair Abelson.
Okay. And so can you let me know if a member of the public appears in the meeting?
Yes.
Yes.
Okay, thank you. Otherwise, I'll assume that they're not here. Fifi or I will call upon you to speak and unmute your mic. And you will have, I'm talking about the public now, and they will have 3 minutes to speak. After 3 minutes, the mic will automatically remute, and the member of the public's hand will be lowered. If an action is required on an agenda item, the chair will call for the vote. Fifi will conduct a roll call vote. When Fifi calls upon you, staff will unmute your mic, you'll vote, and then staff will remute your mic. So far, are there any questions right now? So raise your hand if you have a question. Did it happen? I guess, okay, so no questions. The next item on the agenda is the Pledge of Allegiance. We're going to skip the Pledge of Allegiance due to the virtual platform. Okay, so now we move to introductions,
Which we've already done through the roll call, Chair Abelson, so we
Okay,
can move forward.
So the only thing we don't know about is staff. Maybe we could have staff introduce themselves now.
This is Firdaus Jahan from CCTA.
Peter Engel, CCTA.
Carrie Ann Grover, CCTA.
Okay, thank you. The next item, go ahead, Peter.
I just wanted to point out that Jean Clark is also on. Jean is the alternate for San Pablo, but just so Jean Maria is on too. So we just, when we get to the voting item, we'll only count one of you.
Okay, sounds good. Thank you.
So do you count the person, should they vote in different ways? You would be counting the representative, right?
Just call Maria.
Oh, okay. You'll call Maria, she's the alternate.
No, Jean's the alternate.
That's not what it says on my sheet.
Okay.
I don't know which it is. I'm just knowing, I know what it says on my sheet though.
I'm just looking at the roster and it says that Maria.
Hi, this is Fifi. Let me clear that up. I originally in the roster had Maria as the primary and Jean as the alternate. Once the packet was printed and distributed, I received word from Greg Dreyer at City of San Pablo informing me that it was actually the opposite. I hadn't received confirmation yet, so I just kind of plugged them in where I saw fit.
My bad.
So who is the primary?
So the primary will be Jean. Maria is her alternate.
Okay. Okay. Okay,
So
thank you.
this is their first meeting, which is why they're both attending.
Okay, and that's fine. But should they both vote and vote differently? So only the primary should be voting.
Yep.
And that'll
Yes, one
save
vote
the
per
confusion.
agency.
Yes. Okay, so right now I've lost track of where we are. Introductions. Okay, so there are no members of the public present. And Fifi, have we received any written public comment or any comments?
I have
this
not.
point?
Terry Ann, did you get any emailed to your inbox?
No, we haven't received any public comment.
Thank you.
Okay, and I'll ask just because it's here, is there anyone wishing to speak during public comment on an item that is not part of the agenda? And if so, raise your hand and I or a staff person will call upon you. Are there any hands raised?
Nope.
Okay, so there is no public comment that has been received. Okay, so we'll move on. And the next item on the agenda is the approval of the summary of action items from July 15th, 2019, which is our last meeting, if you can believe that. Are there any changes, comments, et cetera, from the committee? And if so, would you raise your hand? And also, okay. So are there any members of the committee that raised hands? Okay, not,
No hands.
what?
No
Sorry?
hands raised.
No hands? Okay. And now I'm going to ask, is anyone from the public wishing to speak? And if so, please raise your hand. There
No.
isn't, right? Okay. And if there is no further discussion, do I have a motion and a second for this item?
I have a motion from Vice Chair Dowgelli.
I would
Okay.
like to make the motion that we accept the, as written.
Okay, thank you. Is there a second to that motion? Somebody would like to make a second, they have to unmute
I will
themselves.
second it.
Okay, and you are?
Hello, Smith.
Okay, so the motion was by Michael, and the second was by whom? I couldn't hear.
Pello Smith.
Okay, a fellow. Okay. Are we ready to vote?
This
Okay.
is by Ibarra. I think I have a correction.
Okay.
It shows the meeting convening at 2:08,
Mm-hmm.
and then it shows the meeting adjourning at 1:45.
Oh, that's a little interesting.
Oh,
Yeah, I don't remember July very well, but I don't think we did that.
I don't
Okay,
think we
we'll
ever
check on
start
the-
early, so I think
Who's
it
that
was,
Jane went through the wormhole?
Yeah, we went back
Maybe
in
it's-
time.
maybe the correction is 2:45 or, you think?
yeah.
Okay, so to the maker of the motion, is that correction acceptable to you? That would be Michael I'm talking to.
Go ahead, Michael.
That would seem to be a very appropriate correction.
Okay, and is the seconder of the motion, Othello, is that acceptable to you?
Most
Yes.
definitely.
Yes.
Okay, great, thank you. Okay, with that, I believe that we are, and I guess I should ask is if there's any other member of the committee that would like to make a comment on that. Unmute yourself, please.
Does not appear so.
Okay, and there are no members of the public, so that would mean we're ready to vote, and this is a roll call vote, I believe. All votes are roll call votes, I believe. So, do I call the roll, or do you? I know you mark it. Should I call it?
You're Chair Abelson, go ahead and call the names and I'll notate everyone's vote.
Okay. Let's see, I just put one sheet down. There
So
it
you'll
is.
just
Okay.
go back to that.
Okay, so the first is myself, Janet Abelson. I vote yes. I didn't mark who was here, and Charlie's not here.
Charlie, Mary, and Lisa are absent, along with Laura.
Chair.
Lisa, Laura.
Janet,
There she is. Uh-huh.
would you like me to go through the roll call? I've got everybody.
I have it now, but if you want to, that's fine. What do you want to do?
Yeah, just let me go through it here real quick and if you
Okay, go ahead.
Rashida,
Yes.
Bridget,
Yes.
Deanna,
Deanna.
Deanna
Yeah.
Perry,
Yes, I'm here.
Vi,
Yes.
Hello,
Yes.
Kim,
Yes.
Jean,
Yes.
Vice Chair Dogeli,
Yes.
Lori,
Yes.
and Chair Abelson.
Yes.
I think I got everybody.
Okay, so I believe the vote was unanimous.
Correct.
Okay, thank you, everybody. I have to get back to my place. Page 2. I'm confused where we are on this thing I was reading, so I read it and then we did that.
We are on item number 2, Chair Abelson.
2, thank you. Okay, so the next items that follow are informational and are the roster and meeting schedule. So item number 2 is the roster, which is attached, although I must say that I don't have it, but it was attached in the packet.
Yes.
Okay, so maybe I'll be able to find it. And does everyone else have it? Okay, so that's for your information. And the next item after that is the authority upcoming meeting schedule, which is attached. Does everybody have that? Is there anybody who doesn't, I should say? Okay. So do you have any comments about it, Peter? Either one of those items?
No, I don't.
Okay, thank you. Now we'll move on to the regular agenda items. The next item on the agenda is an update on CCTA's Accessible Transportation Strategic Plan from CCTA's Program Manager, Peter Engel. Thank you, Peter. Wait a minute, excuse me. Now I think you give the report.
So I just wanted to give you all an update on the Accessible Transportation Strategic Plan. So we hit this little snag called COVID-19 that has kind of put a damper in our outreach efforts. So we are still in the process. We've kind of pivoted, and rather than obviously having face-to-face meetings or outreach efforts, we are working with the technical advisory committee for the study to do types of meetings, as well as surveys and phone calls, things like that. So we worked with the TAC last month and got a list of ideas, and we have another meeting tomorrow. We're gonna continue working through some of these ideas. What we're doing is planning on putting the surveys into the meal packages when the Meals for Wheels goes out to the different folks. A lot of agencies do client calls to just check in on clients, and we're working with them to have this as a topic, have the accessible transportation study and how their transportation is going as a topic of those phone calls. And then we know of several agencies that are doing regular Zoom meetings with their clients and groups, and that we hope to do outreach through that process. So I just, again, it's kind of been it's kind of put a big shift in what we were originally looking to do for outreach, and it kind of put us behind the 8 ball a little bit. But I think we've got some ideas now, and we're going to move forward and see what kind of response that we get. So that's my update.
Could I ask you a question, Peter? Is this strategic plan for Measure J?
This.
Or what would have been X?
Yeah, what would have been J? What would have been
What
X?
would have been J?
What would have been the second J?
Second J. I mean, I'm confused. I said the wrong. I know what you're saying, but there is no second J.
Right. So actually, we started the study and got the grant even prior to putting together the transportation expenditure plan. The authority wanted to move ahead with doing the accessible transportation study regardless of the measure or going out again for the measure. So we've continued that with the grant funding we received from Caltrans.
So what would we, anything that was specified in the original Measure J would not be subject to change under this strategic plan, would it, or would it?
No, it would not.
Okay. So this would be what I will loosely call enhancements?
Enhancements or any new funding.
Okay.
Yeah.
Which would be enhancement, certainly.
The original Measure J expenditure plan is still in place and we need to follow that.
Yeah, okay. Let's see, the other question I had in trying to sort of set this up is that, so we're in just to sort of restate what you said, I think, is that you're in the process of getting public input right now.
Yes.
And because of the situation with the virus, it hasn't been possible to do it in the usual way, and so you're looking at various ways of doing it. Okay, so at this point, why don't we see what members of the committee want to say? I believe, right? We're ready for that? Okay, so if you are a member of the committee and would like to say something about this plan or the study, and then please raise your hand. And
or if
then,
you're on the phone,
Fifi,
press *9.
Yeah, thank you. And then, Fifi, could you recognize people? Because I can't tell who's
Yes.
doing anything. Okay. So we're ready.
Any questions or comments?
If everyone else is done, I have one comment.
I'm not seeing any raised hands, Chair Abelson.
Okay, the comment I have is that I've been at a number of Zoom meetings since this all began with the virus, and interestingly enough, what's been happening is a really good turnout of members of the public. The Zoom approach that you mentioned, Peter, might actually produce some really good results. People seem to like to be able to attend a meeting that's held in their own living room or wherever they happen to be. It's been a pleasant surprise at a number of meetings that I've been to.
I agree with you 100%. Everything I've seen, there's much more attendance that's occurred on these either phone call meetings or Zoom meetings than we had people that when they had to come down to, into
the office.
The office, the room, the whatever. So I agree with you. It's just so at this point it's a matter of getting on people's agendas or setting up the meetings, and then I think you're right. We'll get and the organizations that you might contact to do the meeting, and being able to get a hold of them is not a trivial matter because they're not all agencies are open, of course. Yeah, that's true.
And so that, but if you get into their, if you're able to get through that barrier, then the actual attendance at meetings is compared to what I would have thought, it's fantastic.
Yeah, I agree.
Anyway, that was the only comment that I had, and this is just for you to present, and then there's no action required, right?
That's correct, and there's still no hands, though.
And there are no hands up still. Okay. So last chance for hands up if anyone wants to say something on this item. Okay. Not hearing anything. We will move. Pardon? Is there a hand up now?
Nope.
Nope. Okay. Well, so not hearing anything, we will move on to the next item. And I assume there's still no members of the public. This is item number 2, approval of fiscal year 2020 to 21, allocation for the Measure J countywide transportation for seniors and people with disabilities, program 15. And staff seeks recommendation for approval of the fiscal year 2021 allocation for the Measure J. I don't know if I said that right. Yeah, I think I did. For the Measure J countywide transportation for seniors and people with disabilities claims as recommended by the PCC. And Peter, you'll give a report?
Yes, so we are at that time of year again where we're getting ready to allocate funds, as you who are operators realize now that we did not ask you to fill out a claim form this year for 2 reasons. One is you are all have been extremely busy trying to take care of your passengers and your clients during these unusual times, as well as it would have been logistically very difficult to get the subcommittee together to review the claims and to go through this stuff. So we talked about it and decided the best course of action would be to waive the claim process this year, but we will be monitoring and asking for reporting throughout the year to make sure that everything is kosher as far as your service delivery. So the bad news now is, of course, the revenues for this coming fiscal year. We are projecting about a 20% reduction in revenues over the last fiscal year at its high point, which was back in January from our predictions. So in the staff report, you have the really super busy spreadsheet. Right now, our total sales tax estimate is $76,500,000. Our chief financial officer has a meeting with our consultants this afternoon that help us do these projections, and we're hoping that number doesn't come down again. So basically, it's come down from the mid-year projection of 94 million to, for this year, 80.5 million, and then we're expecting an additional drop for next year down to 76.5. So of course, what that means to the operators is less funding through Measure J, which I think for the most part, at least the public transit operators have expected. I know this will be difficult for the cities, the small towns that rely on Measure J, but this is kind of the way it works, is if the sales tax funds don't come in, we don't have those to help contribute to your operation. So we are looking at roughly, if page 15 to 16 of the staff report at the bottom is the amount that we're currently looking for you to budget. How the allocation is going to work is we are going to allocate for 6 months and hope that come the first of the calendar year, January, February, we'll have a better idea of how sales tax revenues are coming in. The bottom line is right now, it's a guess. I mean, we don't know if we've hit the bottom of what's going on with revenues, and we don't know how quickly we'll start to recover. So we're hoping 6 months down the road we'll have a better picture, and it'll be a good exercise for us to be able to go back to our board in January with new numbers, and hopefully they'll be better than this $76,500,000 number and not worse. So at that point, at mid-year, we will make an adjustment to the allocation based on the new numbers, and then issue payment to the operators based on that. So we're going to issue 2 payments next year. One in July after the board approves this number for half the year, and then one in January/February when the board approves the second half of the year. So that is my staff report. I'm happy to take any questions. And of course, all this is subject to authority board approval.
Okay, are there any questions from the board? Are there any hands raised?
I don't see any hands. Oh,
Okay.
I have a thumbs up.
Wrong emoji, sorry.
Okay.
Okay.
Yeah, just when you said like next year in July, so you're saying July 2021?
July 2020, sorry.
Okay, so in 2 months.
Yes.
Okay, July 2020, and then January, February of 2021. Okay.
Correct.
Making sure sorry, new to the group,
Yeah.
so just making
So
sure that I quite.
This is for fiscal year 2021, so July 1st through June 3rd, July 1st,
Right.
2020 through June 30th, 2021.
And then the review on, so in July 2020, we should expect to get kind of what we've normally received?
No, you will get, so your San Pablo. So let me look here at San Pablo. So we scroll down to the bottom. San Pablo is scheduled to get, so this number here is for the whole year. So the first 6 months, so it would be half that. So say the 166,770, it would be half that number. And then we're only issuing 90%, similar to what we do now. We only pay 90%, and then we reconcile at the end of the year when we know the actuals. So we're going to do that same thing. So it's just the whole numbers coming down from previous years.
Right.
Just because the total numbers coming down. So I can't remember off the top of my head what you guys got last year to make that comparison. So.
Any other comments or questions from the committee? So I have a couple of things. One is to mention that we're just talking right now about Measure J funding, right?
Correct.
Okay, so the unfortunate issue for our jurisdictions is that this is not the only source of income that will be negatively impacted by what's been going on with the virus, because cities, for example, directly receive sales tax. And doesn't BART receive sales tax too?
Yeah, I believe they do, yeah.
And does AC Transit, or is it parcel taxes?
Everybody receives some form of gasoline sales tax or general merchandise sales tax.
Mm-hmm. So the negative impact of what's going on right now is not. It's bad enough that I'm sorry, my phone is going off and I don't know how to stop it. But it's not just the sales tax; it's that plus other things, which makes it even worse, and it makes it very difficult for the various jurisdictions to handle all of these unfortunate things that are going on financially, and I'll leave it at that. Okay, so are there any further questions from the committee? Okay, not hearing any. Did you have anything further, Peter, on this item?
No, this is an action item though, so we need.
Okay, so what we need to do is approve the 6 months, the 6 month period.
Yes.
Current 6 month period.
Yeah.
Okay, is there a motion? Anybody want to make a motion?
I make a
Yes,
motion to
Michael,
approve the 6 month budget.
Okay, and who are you?
Jean Clark.
Michael.
I'm sorry.
Never mind.
Wait, first person.
Sorry, Vice Chair Michael Dodgelli had his hand up to make the motion first. He made the motion. Jean, would you like to second the motion?
Would you like to second the motion? Jean?
Oh, she's.
You have to unmute yourself.
I said yes.
Yeah.
You said yes? Okay.
Yes.
Okay. So there's a motion and a second to approve the recommendation and
Lori Reese Brown has her hand up, so I'm going to.
okay.
Go ahead, Lori.
Well, I think I had my hand up a little too late. I was going to second that motion.
Oh, okay.
Oh, okay. So are there any hands up right now?
No.
Okay.
First from Michael and a second from Jean.
Pardon?
We have a first from Michael and a second from Jean.
Right. Okay. So now we'll have a roll call vote. And so, Peter, are you going to call the roll again?
Yeah, let me unmute everybody. So we can,
Okay.
I think everybody's unmuting here. Okay. Bridget,
Yes.
Anna,
Yes.
Kimberly,
Yes.
hello,
Yes.
Rashida,
Yes.
Jean,
Yes.
Vi,
Yes.
Lori Reese Brown,
Yes.
Vice Chair Dowgelli,
Yes.
Chair Abelson.
Yes.
Did I miss anybody? Then the name started jumping around on me.
Nope, you got them all. Chair Abelson, it looks like the motion passes unanimously.
Okay. Thank you. And thank you, everyone. We'll move on to the next item now, which is the Service Review Advisory Committee report. The Service Review Advisory Committee has not been meeting because of the meetings have been canceled because of the virus. And but I thought since that it would be interesting, I thought to just mention some of the things that I've observed that have gone on that are different. One is that they've changed the nature of the service, as I understand it, for probably the duration of the virus. And so you can't go any place that's within 3/4 of a mile of fixed route transit now. What you can go to essential places that are essential services. And so for example, if I wanted to go to my son's house for Mother's Day and I was unable to do that because that was house to house, but I could go to the grocery store, I could go to Target, which is a form of a grocery store. So the essential services you can still do. I know I personally got a call from Kaiser telling me I should not be coming there. It was too dangerous health-wise. So they canceled all my appointments. So things like that are happening. At the same time, there are some really nice things happening. Paratransit has really stepped in, from what I've heard, to help deliver Meals on Wheels. Is that right, Kim? Do you know anything about it? Or Kim?
That's correct.
Yeah. So they've really, I think, done a good job of trying to fill in the gaps that have been created by the virus situation. And I don't know what's happened in other service areas, but it's been really helpful. I know on a personal level, at the beginning of it, I was having a hard time figuring out how to get food. And they actually went to the grocery store for me and brought the food to me, which I was very grateful for. So they're doing some really helpful thinking and planning and doing to make things better for people who use their service. So anyway, I'll leave it at that. Other than if there's a question, I'll try to answer it. Not hearing any. I think we're ready to move on. The next item is the Senior Mobility Action Council. Is there anybody here who can speak to that? I think there may not be.
Rashida said she can do it.
Rashida can do it? Okay, Rashida? You have to unmute yourself.
I don't have that much to say. We haven't met in a few months. And our first meeting was actually today. So in quite a few months. So there's no new update with that. So the next BCC might have something a little bit more concrete. They're working on some things on the meeting now. I had to leave the meeting to come to this meeting.
Uh-huh. Okay. How is seems somewhat related, the service in your area? Are there changes, or is it just sort of business as usual?
Oh, no, it's not business as usual at all. Services in my area dropped about 80% after the 16th of March, after the governor's stay-at-home order. We transported inadvertently 2 passengers. We had 2 passengers that we were notified after the fact that they were positive. We have systematically been reducing the amount of people we've had in the vehicle as social distancing is being enforced. For the past 6 weeks, it's really only been just 1 person per vehicle. Like you mentioned earlier, we're also working with the county to do Meals on Wheels. We partner with them. They came and they did some orientation with us. The county reached out to us when they activated the EOC for help transporting COVID patients, individuals that were tested positive for COVID, either from the hospital to some congregate living or some kind of a shelter, to the hospital or to a hotel or vice versa. And so we had inquired of the county that, we are not trained or equipped to do that kind of transport, even though we would love to. So they said, basically, what do you need in order to make it happen? And the reason why they reached out to the transit agencies for this type of service is because the 6 feet, they used to use taxis, but the 6 feet social distancing order could not be applied in a taxi. So they reached out to public transportation services like myself and Tri-Delta and the rest of the individuals. Anyway, cut a long story short, we said, because at that time there was a nationwide shortage of PPEs, we basically said, if you are able to provide PPEs and training, we'll get volunteer drivers to do this. The fear of COVID at that time. Now we've kind of gotten used to the virus a little bit, but in those first initial weeks, to get a driver, for you to tell somebody that somebody who's COVID positive and they live in your neighborhood, you're liable to burn the whole neighborhood down. But now, so we asked the county to come and do training, and so they had healthcare workers from the county health department come and train us. It was about an hour's training. What is COVID? How to protect yourself? How to protect yourself at work? How to protect yourself personally? How the virus actually works? How it's transmitted. It was extremely helpful. At first, they thought that they could give us the information and we provide the training, but we basically told them we're not medical professionals, we're transit professionals. So you provide the training for us and we will take what you've given us and build an operations protocol based on that. We know how to modify our transportation protocols with a certain threat or a certain type of safety concern in mind. So that's what we did. The drivers that are doing our COVID transports for the county are segregated drivers. They do not get mixed into the general ADA population or the meals program. The vehicles that we use are segregated vehicles. They do not get mixed into the program. There's a protocol. The drivers wear full PPEs. They got overalls, shields, face masks, gloves, little Comcast booties, surgeon boots for the transports. So that's going pretty well. We were transporting about 20, 30 a week. Now we're down to about 10 or so a week transports. The other day we had a bit of an incident. We were transporting somebody from the hospital to a hotel. We've been doing that a lot. And it was 2 people. It was the first time that we were transporting 2 people at the time. And they had asked for a pit stop, which we didn't realize that we weren't supposed to be doing. I mean, nobody else is being transported. The driver's not rushing to go pick up somebody else. So this is kind of like a slow and steady trip. The male passenger got irate because I guess he couldn't find his wallet, got violent in the vehicle, started breaking things. 911 was called. That passenger was escorted off the vehicle. We decided to take the other passenger. Then about halfway to the trip, she got irate, came out of her mask, came out of all of her protective gear. Our vehicles that do the COVID transport are actually, there's a plastic covering that protects individuals that are in the back from the driver. Well, she ripped up, she was on the vehicle, moving as the vehicle was moving, ripped up the protective shield. So the drivers are not supposed to wear the face shield when they're actually driving, but they do have on the mask. But can you imagine? She's screaming profanity. She's moving as he's trying to, and he's on the freeway. So he's actually trying to get off. He's trying to get off the freeway and safely bring his vehicle to a stop, plus her screaming profanities, her walking on the bus. I mean, the whole thing is on video. So that meant that we needed to kind of scale back what we're doing and rewrite protocols. The point of that story is that we've been writing this thing as we're going along. But the good news is that we are writing it. We're writing the book on how this is going to happen. We've spent years doing emergency protocols, you know, with our EOCs and the counties. We know what to do with an earthquake. We now know what to do with the fire. But for some strange reason, we weren't really sure what to do with the pandemic. So we've been writing this as we've been going along. So the good news is that we know that transportation companies can pivot. They can meet the needs of the community. The community can't get in buses because they need to social distance to go get their food. No problem. We can go get the food and we'll bring the food to you. They can't get on public transportation because they need to be transported from hospital to congregate living. No problem. We will segregate the transportation systems and we will divide it up a little bit and we will manage the resources in a manner in which we can help you do that. The other thing that we've been doing is that we've been helping schools deliver nutrition meals to up to, I think we're servicing about 250 students now in all of these cities. So that's good. You know, you didn't realize how much that was a need until this actually happened. So there's several little programs that, you know, we've been involved in and trying to meet the needs of the community. We haven't been able to put butts in the seats, but we've been able to put meals in the seats and grocery bags in the seats. And we've been able to sustain our communities through these modified services. And thank goodness for the CARE Act, because using that CARE Act in order to be able to change the scope of the services to meet the needs of the community is going to be absolutely invaluable. So that's what we've been in a nutshell. That's like 8 weeks of drama in 5 minutes, nutshell.
Wow. Are there anyone else want to comment on this? Okay.
I just had one question about the CARE Act. What kind of bigger things have you been doing with the CARE Act?
I'm sorry, say that again?
How have you been using the CARES Act funding?
Well,
and I'm sorry, you are?
Jean Clark.
Thank you.
There were guidelines that were released on how that funding could be used specifically. Things like Meals on Wheels, food delivery program, grocery delivery programs, even the PUI transport, the COVID transport. Those are things that you have to look at the guidelines to see specifically. But they're general. They're now in line with what we decide, what was necessary to help the community. So that was good. What it does strongly recommend there is that you amend your contracts with your providers, if you have any, to define the scope of work, you know, specifically, because you have a certain set of funds that you use for the scope of work that you have to be able to prove that, number one, all your backup documentation that these services were used for that, and you have backup documentation, and that you have some kind of scope of work that is identified with your contractors, that's binding, a legal contract that identifies this so that it's possible.
So has any of this been done? I mean, like, are we considered basically contractors? And has there been any kind of on a bigger scale applying for this funding to supplement the Measure J funding that we're losing?
So my understanding is So the CARES Act funds that came out through the transit came through the Federal Transit Administration. So if you aren't a recipient of FTA funds or identified as a public transit operator to the FTA, you are not eligible to receive those funds unless Rashida might know something that I don't know, that there's some kind of a special thing. So that would be a concern for the city operations because you aren't FTA recipients. Now, the new stimulus, the HEROES Act that's supposedly going to be going through legislature is going to have, well, again, this is all subject to, going through the legislature, but the idea would be that there would be funds for state and local governments. So if your cities were able to receive those funds, because the cities all have increased, police or first responder costs, but you as the, paratransit operator within that city doing those types of programs like Rashida was describing, I would think that those funds would be available. I would just encourage you maybe to reach out to your or your council members to reach out to their federal advocates or federal lobbyists if they have them to, ensure that the city gets their fair, or that, local jurisdictions get their fair share of that next stimulus package. And, costs of your operation should be part of that.
Okay.
So, Peter, I heard that, Bridget, are you still here?
Bridget's, yeah.
Yes,
Pardon?
I'm here.
Hi, I heard that El Cerrito is doing the meal delivery differently right now. Does that fit within the guidelines that are being referred to? Maybe you could explain what you're doing along the way, because I think it's really interesting.
I would say I believe we are using our paratransit vehicles and drivers to deliver weekly meals for the Coco Cafe program that we have.
As is San Pablo.
Yeah.
That's why I was just curious about the CARES funding on that. I mean, we're not Meals on Wheels. And so when I was reading through it, our organization's interpretation of it is that we are actually, one of their providers. So like as Rashida said, you got to look at all your contracts and redo them with your providers, but that our city kind of looked at it as we were actually one of the providers. So we wouldn't really be eligible for applying for that CARES funding, even though we are supplying those meals, that it would be probably someone like the county applying and we're one of their contractors, right? And so I was just kind of seeing what other people's opinion on that was.
Yeah, that might be the angle, is you're a contractor with the county. Again, I don't know that much about the CARES. I kind of follow the transit side of it, but if the county's getting funds from CARES that they're able, that might be something, or the new stimulus, the HEROES, which is going through.
Yeah.
But what's important for you all to do is document these costs and, make sure you're, get in line with, to make sure that you can get some of that funding.
Thanks for the discussion, guys. I appreciate it. Like I said, kind of new to the group, so I just kind of wanted to see what other people were doing. I appreciate it.
Good questions.
Well, this is a very busy time that way because we're not doing the same old usual things because life has changed. Bridget, addressing the program you're doing, and I'm wondering if San Pablo is doing the same. You deliver, instead of delivering 5 lunches a week, if that's what it used to be, you now deliver 7 meals, but deliver it 1 day a week, right?
The county program is 7 frozen meals, milk, bread, and fruit. And we deliver it once a week. We're delivering it to anyone that lives within our city limits. And then we have some participants that live outside of city limits that come to our facility to pick it up.
Mm-hmm. And do they pay for these meals?
It's the same as our congregate meal program. It's a suggested donation.
So and what's the suggested donation?
It's $3 per meal. And so people are giving what they are able to give.
Uh-huh.
So,
And do they seem to do well with this once a week idea? Do
I
they
think
have
the
room to
people
store
that
it, for
are getting-
example?
They seem to be happy to receive the food, yeah.
Mm-hmm.
And it's definitely more manageable on our end to have one day figuring out how to deliver the meals. It takes a lot of staff time as opposed to trying to do it multiple days during a week.
Mm-hmm.
For San Pablo, we've definitely, and Maria, maybe you want to jump in here, but our numbers have almost doubled and tripled to the amount of meals that we serve and the amount of meals that we're delivering. We've actually gone to 2 different delivery days now to accommodate the need. It's been huge.
Yeah, I was gonna say, we have also doubled our numbers, but
Yeah,
we've added drivers. So we've got 2 routes going right now. But we've seen a really large increase in the number of people we're serving in this fashion.
and so instead of adding drivers, we added days. Yeah.
Yeah.
It's a huge need.
Peter?
Lori Reese Brown has her hand up, so I'm going to unmute her.
Okay. Thank you. Hi, Lori.
Maybe a question.
You there?
Maybe a question. Yes, I am. This may be
Okay.
a question. This may be a question for you, Peter. With the COVID-19, the funds that are through the stimulus package for COVID-19, do you think that we should start thinking or rethinking our paratransit programs? I know that we have never really dealt with the meal program except for getting, well, in a way we have transporting seniors to the senior center for their meals, but now we have to rethink that. We have only a few patrons that we've actually been delivering meals to, not that many, but I think that what may happen in recent months is we may get an influx of more seniors or disabled persons who may need these meals delivered. So in that stimulus package, first of all, do you know if there's any more money or funding left? I'm hearing that it's all exhausted and that they're looking at additional stimulus funds that may or may not come through. What recommendation would you give to the operators in cities and private to how we could start revamping our programs, pretty much like Rashida has done in terms of, qualifying for some of the stimulus money? I hope that wasn't there was too many questions in there.
I really can't make any, it's not that I wouldn't if I knew, but I can't really make any recommendations on how you would revamp your program to be eligible for the stimulus money, because I don't know. The stimulus money, like we said, that came through the first stimulus, the CARES Act, like I said, there was lots of different packages, right? There was an unemployment package. There was a, small business loans package. There was all these different kind of packages that were part of that. And one of them was for transit relief. As far as I know, all of that went through the Federal Transit Administration out to FTA recipients, which are the public transit operators. So WestCat, County Connection, AC Transit, BART, they were the ones that were eligible for all that. So, Richmond and San Pablo and El Cerrito really were not eligible, at least for that package, that public transit package. Whether there was other packages, that went to cities or local jurisdictions or the county, I don't know the details on those to advise or recommend anything about how you change your services.
I remember. I'm sorry, Peter. Yeah, I'm sorry.
The new one, the HEROES Act, which it just was passed at the House level. It still needs to go through the Senate. It's going to change a lot. Again, I don't know. I just heard that there's a big chunk of money from that was a priority for Nancy Pelosi to have funds that go to states and local jurisdictions to help with their costs. it seems to me that, you cities are all local jurisdictions. And, you're going to have, first responder costs that have increased, but don't let your city council forget that you guys have costs as well, from what your services you're providing that need to be put on the list. So, that's the only thing I can think. And whether there's certain, things that are eligible and not eligible, I don't know. The bottom line is the service you provide every day or have provided up to this point would all have been eligible. So I think in the short term, everything that people are doing is spot on, providing, transporting meal. You can't transport people right now. So you're transporting meals to people. I think that's the way to do it. That's the best way to spend the Measure J funds out of this program right now. Now, as time goes on, the goal also is to get people out of their homes and part of the community. So, when it's safe and when you guys are going to have to go through that process yourself to decide when you can start transporting people safely again to get them back out into community and get them to their doctor's offices. But in the meantime, these hybrid programs are something that we would support from the authorities' perspective, to provide services to seniors and people with disabilities.
Okay, well, that was very thorough, and thank you so very much. I appreciate that. It's, I think that's one of the challenges that all of us are facing now, and I think at some point, maybe sooner than later, we could probably talk about maybe how we could do some partnership type of deals, if that would even work. Since our Measure J funding is going to be cut, and some people and some entities may not know where their next funding source is going to come from to support senior services and disabled services. So, it's just a thought, and thank you so very much for answering that question.
Thanks, Lori.
Mm-hmm. Are there any further points on this item? I think it was really helpful to have the discussion, and thank you everybody for contributing. The next, moving along on the agenda, says, do any committee members want to add a topic for our future agenda items, which is the next item on the agenda? Well, I think there could be an item that would address COVID-19 issues. I guess is what I would call it, as it affects paratransit in particular. Would that be a reasonable thing to put on the agenda, Peter?
Yeah. Is there any, you want us to kind of come up with there's probably too much there to do in one meeting, but maybe we
right.
Can, do a series over a few meetings that kind of, and have a topic.
Yeah, like what's a good, what are people, I think just the sharing is interesting.
Yeah.
It's an opportunity for people to gather by phone and computer and iPad and so forth, and talk about what they're doing. And it's a very fluid thing. What they're doing today may not be the same as what they're doing 2 weeks from now. It's changing and evolving. And what I've noticed is the various agencies are doing a really good job of innovating and trying to come up with solutions that are the best solutions for the people in their service area, which I think we all appreciate. So if we could just have, maybe we could just have reports from various agencies about what they're doing in that regard, because the problem is now we may not know now what's going to be happening in a month.
Yeah,
even,
that's right.
So can we make it a fluid topic like that?
Sure.
To give people the opportunity to share. And as I understand it, we're going to be moving to, things are getting better. and the restrictions are being loosened, but that doesn't mean they're loosened. That doesn't mean the restrictions are gone. So then there may be an evolution of what practices are occurring. So,
Right.
okay. Anybody want to add anything to that or to another future agenda item?
No hands.
Nope. Okay. And correspondence and communications? Is there any correspondence or communications?
I didn't receive any.
Okay. Could we check in with how people thought this meeting went in format? Does anybody have a comment on that?
Yeah, Rashida got a thumbs up. She's happy.
Who's that?
Rashida Kamara.
Oh, okay. Thank you.
Hello, and Kimberly, Jean. Oh, I'm seeing a lot of thumbs up. I think this went well. It was a great first time.
Mhm.
And now that we kind of got all the kinks worked out, it should run smoothly.
Mhm. And I think everybody really gave it their all and to make it work. Both staff, which I sincerely appreciate. I think we all do, and also the members of the committee were very easy to work with in terms of letting other people speak and all of that stuff. That seemed to go very easily today. So thank you to everybody. And if there's nothing else, is there any one last thing somebody wants to say? Okay, not hearing any.
We have a hand.
Our next, I'm sorry, go
We do
ahead.
have a hand from Vice Chair Dowjali.
Okay.
It's just so nice to hear real human voices for a change and not just text messages and
Isn't it?
it is.
Yes. And our next meeting is scheduled for July 20th, which sounds like our regular meeting date, right, Peter?
Yes, that's correct.
And so I hope to communicate with you then. And I hope in the meanwhile things will have gotten better. And thank you all for participating today. And I look forward to communicating at the next meeting, one way or the other. Thank you. The meeting is adjourned. Are we done?
Thank you.
Okay.
Thanks, Janet.
Thank you. So, PV?
I'm here.
Oh, do we need to do anything else?
You don't. Terry Ann and I are going to work together now, and she's going to